So I wanted to become a doctor from the time I was really little. For good or ill, I underwent many medical procedures and had many accidents when I was little, whether it be breaking my leg when I was 3 or breaking my arm in the subsequent times just in the rough and tumble play of being a kid. I had other interests as well, but what really solidified my desire to become a doctor was when I was 18 and about to go to college. I was diagnosed with a intestinal disease called ulcerative colitis. My doctor told me at that point that I had probably would do better to go to community college and to give up any dream I had of becoming a doctor. At that point, I no longer saw him and continued on to go to University of Virginia on my scholarship. But at that point, I became very interested in gastrointestinal medicine and did some research at that time and developed a very strong relationship with my gastroenterologist there and thought for quite a while that I would become a gastroenterologist. One of my best friends in undergrad ended up going to University of Virginia and told me a little bit about a field called interventional radiology because he was a year ahead of me, and he told me that he thought I would like it. And so during medical school, I explored it a little bit, and I fell in love. And so that's how not only I became a doctor, but fell in love with this specialty. My favorite thing about being a doctor is spending time and getting to know my patients. As much as I enjoy doing the procedures, really digging into what makes a person tick and how I can make them feel better really is important to me. And whether it be with a patient or the patient's family, you derive a lot of joy in being a doctor, not necessarily just by fixing someone's arm or fixing someone's leg, but really getting to understand how you're going to help the whole person and potentially even help someone's whole family. And having been a patient, it's so important to me to educate people to understand what is going on, and it's not just the patient, but also the patient's family who can really benefit from understanding what's going on. Because if they do, it might not be just the patient you're dealing with, but multiple members of the same family that you can help. So that's my favorite thing about being a doctor. I have a certain level of empathy and understanding because I've been in the bed, I've laid in the stretcher, I've been put to sleep, and I've had a lot of procedures done on me. And what's really important from my perspective as a physician is being able to help patients understand exactly what's going on, but also treat people with a degree of empathy because I have been through those things.